start with doing a deep dive into the background for today's topic, which is saving lives with innovative blood management systems. So this topic will focus on the development and implementation of advanced technologies to improve efficiency and effectiveness of blood collection, storage, and distribution. It also aims to address critical issues such as blood shortages, wastage, and the logistical challenges of ensuring timely and safe blood transfusions. Now, we all know that it can be very heartbreaking to be desperately in need of blood to save a loved one, but for some reason or another reason, the blood or its products are just not available at the time of need. So this can be due to either lack of awareness and education. Now, we know that most people in low-income countries are not aware of the importance of blood donation. So there are mostly misconceptions around these processes, which probably discourages potential donors from donating and then can contribute to low donation rates. We also know that there are some very core and strong cultural and religious beliefs that generally discourage blood donations all around. Another reason is inadequate infrastructure. So in low-income countries, we often lack the necessary infrastructures for like efficient blood collection, storage, and distribution. So this then makes it that blood banks and donation centers are scarce, and those that exist may not even have the resources to maintain proper storage condition, which would then lead to wastage of collected blood. Now, we know that low blood donation rates are a significant global health challenge, but here are some key statistics illustrating this issue. So according to the World Health Organization, there is a major discrepancy in the level of access to blood between low and high income countries. So in low income countries, the blood donation rate is significantly lower, averaging around 4.6 donations per 1,000 people, compared to about 32.1 donations per 1,000 people in high income countries. So many low and middle income countries struggle to meet their blood supply needs. So for instance, the WHO estimates that these countries will probably face a shortage of up to 40% in their blood supply requirements. Now, the impact that this has on healthcare is very detrimental due to the fact that the lack of sufficient blood donations leads to critical storages affecting essential medical procedures such as surgeries, trauma care, cancer treatments, and maternal care. For example, in sub-Saharan Africa, we have the highest demand for blood transfusions due to high rates of maternal hemorrhage, severe childhood anemia, and trauma. Yet, we still have some of the lowest blood donation rates. So these statistics pretty much highlight the critical need for enhanced blood donation awareness, infrastructures, policies, particularly in low and middle income countries, to ensure that there's reliable and safe blood supply for everybody. Now, the incorporation of technology, such as mobile applications, digital innovation, and mixed reality experiences have significantly transformed traditional strategies and approaches to blood donation and management systems. Generally, digital tools provide important insights into donor behavior, demographics, and preferences through data analytics. Similarly, these innovations ensure that data are used to make informed decisions. So this 22nd episode of the Insights webinar will be taking a deep dive into the blood crisis in developing countries, some of the challenges we face with blood donation, management and supply, and then the innovative solutions and technologies which have significantly improved the blood management system overall. So on our panel today, we have very seasoned experts and leaders who have invested their time and resources in saving lives through innovative blood information systems. So I'll be introducing every panelist and I'll be reading their profiles. Afterwards, they'll say hello to everybody that's currently on the call, and then we'll proceed. So in no particular order, the first person I have on the panel is Jamil Galadanchi, who is the Senior Manager in Global Health Informatics Unit here at eHealth Africa. He was also a lecturer at the Department of Computer Science, Bayero University, Kano. He was also a data manager consultant in the Vanderbilt Institute for Global Health Informatics Research Projects in collaboration with Aminu Kano Teaching Hospital. He is a counsel for the regulation of engineering in Nigeria, registered software engineer, a Prince 2 certified project manager, and a member of the American Software Testing Qualification Board. He's also skilled in research, projects, and human management, software engineering practices, health informatics, and software quality assurance. So please, would like you to say hello, Jamil.
Hello, everybody. Nice to have you here.
Okay, thank you for that, Jamil. So the next person we have on our panel is Dr. Aisha Amal Galadanchi, who is a consultant hematologist at Aminu Kano Teaching Hospital and also a senior lecturer in the Department of Hematology at Bayero University Kano, where she teaches clinical and laboratory hematology. She's also an alumnus of Vanderbilt Institute for Research Development and Ethics and a recipient of the American Society of Hematology Visitor Training Program. Dr. Galadanchi was the medical monitor in Nigeria for several National Institutes of Health and Trasher-funded primary and secondary stroke prevention trials in children with sickle cell disease. Her research focuses on newborn screening and premarital genetic counseling for sickle cell disease. She has collaborated with many institutions, both local and international, and has published numerous articles in high-impact journals, and she's a fellow of the Nigerian Postgraduate Medical College in Pathology. So please, would like you to say hello, Dr. Aisha. Hi, Dr. Aisha.
Everyone. Yeah, okay. Hello, everyone. Nice to have you here. Thank you.
Okay, thank you, Dr. Aisha. And the third and final person we have on the panel is Dr. Ibrahim Musa Idris, who is currently the head of hematology at the Aminu Kano Teaching Hospital. He is a board-certified doctor in hematology and transfusion medicine and has been since 2016. Over the past 5 years, he has dedicated his career to understanding the clinical epidemiology and treatment strategies of sickle cell disease-related neurological injuries, recurrent ischemic priapism, and sexual dysfunction in adults with sickle cell disease. Dr. Ibrahim Musa is also the first and only Nigerian to win the American Society of Hematology Global Research Award. This happened in 2021 for his research in a randomized controlled double-blind trial for prevention of recurrent ischemic priapism in men with sickle cell anemia. He has 2 prestigious fellowships, which are the VECD Fogatti Global Health Fellowship and the American Society of Hematology Clinical Research Training Institute Fellowship. So would like you to say hello to us, Dr. Ibrahim.
Hello, lovely everyone. I'm glad to be here.
Okay, thank you very much for that. So we're just going to dive right of the blood management system from top to bottom. So we can have Jamil go first, and then we can have Dr. Amal and then Dr. Ibrahim go next. So please go ahead.
Onome, can you come again with the question? We missed you for a few seconds.
Okay, sorry about that. So the very first question we have today for this panel is to give us an overview of the blood management system. So we can have Jamil go first, and then we can have Dr. Aisha go next, and then Dr. Ibrahim, in that order, please.
All right, thank you, Onome, and good afternoon, everybody. Once again, it's good to be here. To respond straight to your question, so a blood information management system is a software, a specialized software solution that consists of both mobile and web applications, just like you said in your background, Onome, that are designed to manage various aspects of blood donation chain. This starts from the initial blood donation from donors to storage, to testing and distribution of the blood products to health facilities and other blood banks. So overall, a blood information management system plays a crucial role in ensuring the safety, availability, and efficient utilization of blood products for transfusion. And this ultimately contribute to improved patient outcomes and healthcare delivery. Over.
Okay, thank you for that, Jamil. So could we have Dr. Aisha please go next to give us an overview of blood management system?
Okay, hello everyone once again. So blood management system is crucial to the provision, sustainability, and safety of blood and blood transfusion. I'm talking from the clinical aspect, and it has various components. So it starts from the donor recruitment, and usually the donors, preferably the safest donors, are the voluntary non-remunerated donors. And then it goes to testing and processing of the blood, because when the donors donate the blood, it needs to go through various processes to ensure its safety, like the testing for infectious diseases, HIV, hepatitis, syphilis. And then the next stage is the storage of the blood, which requires sophisticated equipment, because various components are stored at various temperatures. For instance, platelets is stored at a different temperature, is stored at 20 degrees Celsius compared to other components like the red cells and etc. And also another aspect is the transportation of the blood to where it needs to be transported. That is also another crucial aspect of the blood management system. Thank you.
Okay, thank you for that, Dr. Aisha. Dr. Ibrahim, please, would like to hear your thoughts on the overall system of the blood management.
Well, my colleagues have really spoken very well about this subject matter. So in summary, I think if I can summarize, blood management system has two components to me, and this is the supply aspect of it and the demand aspect of it. So in the supply aspect of it is where you talk about the donor, his safety first, and the safety of the product he's going to have. And at this level, you need information. You need information about the donor. You need also to store this information about the donor and his safety and document that. Then the demand aspect is where who wants the blood, who uses the blood, and that's also a lot of information go into that. It's like two components coming together. Who gives the blood, who uses the blood, and in between, you have to integrate this information for you to ensure safety of both the donor and the blood. So the whole management, I think, can be summarized in that aspect.
Okay, thank you so much, Dr. Ibrahim. So those are very insightful answers around what the blood management system offers. So we'll just go right into the next question, which will be for Jamil. So EHA recently developed BISCIT, which is the blood information system for crisis management and intervention to ensure consistent blood supply. So would you like to tell us the motivation behind the emergence of this solution, please?
Yes, sure, Nanomi. So actually the motivation behind the development of BISCIT system, which is the blood donation system that we are discussing, was actually driven by a research conducted by a consortium of researchers from multiple universities in Berlin, Germany, and funded by the German government. From the research, it was established that the supply of safe blood products is essential for a normal functional health system, just like what we have all mentioned. But then the deficiencies in this supply chain was acutely problematic, especially during crisis. And the ability to increase incoming supply of blood products and manipulate existing stock to respond to emergency is quite crucial. So this gave birth to BISCIT, which is a digital tool that aims to provide the much needed end-to-end digitalization of the blood donation chain space based on those two components that Dr. Ibrahim mentioned. That is from the donor, that's from the supply side to demand side. And the first BISCIT use case was designed and built for the South African blood supply chain context, where the supply of safe blood components remains a challenge, especially in the face of increasing rates of infections in the population with malaria and other parasitic diseases, and especially HIV. And even under routine conditions, only a part of the demand are being met. And while in the event of crisis, the existing supply systems that they had was not able to cope in effectively planning the crisis when it arises. So after the completion of the research and seeing the potential of the BISCIT application, eHealth Africa, as a way of giving back to the digital health space decided to invest further on the system in order to ensure that it is customized to fit the Nigerian context, and also to identify the right partner, which is AKTH now, that shares the same passion and foresight to achieve that much needed end-to-end digitalization of the blood donation chain space, and thus ensuring that an efficient and quality blood products are always available when needed. Thank you.
Okay, thank you, Jamil, for that answer. I think just as a follow-up, and just in a few sentences, I think it would be nice to know some of the features of BizKit and what it currently offers in, bridging the gap for crisis management within the blood information system. So you could just give us a few features that are currently on the BizKit application.
Jamil is muted.
Okay, sorry, I was muted. So I was saying that the key features can be categorized based on the Clinics app and the Donor app, which is mainly what that components that were mentioned earlier on. The Clinics app are the supply side, right? So we have an application that can be accessed by the clinicians and other medical officers. And this includes the donor information, the transfusion information, the patient information, the blood bank, and other necessary notifications that would, allow the medical officers to get real-time information of what data or who has accessed the system. And it also keeps inventory of all the products available in the blood banks that were recorded via the application. It also has a consolidated dashboard for high-level decisions. On the donor application side, this is where a blood donor is able to access the information, schedule an appointment, and also be able to manage his or her appointments, and would also be able to enter all the donor information. There's also a chatbot for help, and he or she would be able to see the history of the blood donations she or he has made in the past, and also the journey of that donation. So donors are able to see literally the impact their donation is making down the chain. And they also have notification services, both in the application and as an email and as SMS, to notify them of their upcoming appointments, and also if there are donation drives and other events coming up, we're able to push those information. So these are just a few of the, it will take the entire time to explore the entire system, but these are just a few of the features we have on the system. Thank you.
Thank you so much, Jamil, for that. That was very, very comprehensive. So we'll just delve into the other questions that we have. So Dr. Aisha, there's currently a belief that blood donation is cheap or free, but accessing it is expensive. This is the general belief. So could you provide like an explanation to this? Would like to hear your thoughts around this, please.
All right. Blood donation is actually provided by a voluntary donor who doesn't get any payment on this. Therefore, that's why people have a perception that blood donation is actually free. However, the processes along with the blood testing and other part of the blood processing are actually expensive because they incur significant amount of cost. For example, when you talk about the equipment needed to actually test, the blood, to actually process the blood, are highly expensive. For instance, if we're talking about blood separation into components, we need like a cold centrifuge, which is really expensive. And when you're talking about the storage of the blood, actually the equipment needed, the refrigerators are highly sophisticated refrigerators, because some of the blood components and products have to be stored in like a very low temperature. as low as minus 80 degrees. And not all facilities have all this. So it really incurs a lot of cost. And then another thing is actually even the blood bag for the donation is really, it's costly. About 2 years ago or before 2 years ago, we used to get the blood bag at 500 naira per bag or 700 naira per bag. But last 2 years, it was crazy. There was shortage of the blood bags. I think it was a national problem. So we couldn't get the blood bags anywhere. And they were charging us like 3,000 to 4,000 naira per bag. So this is really expensive. Then also you have to think of the other infrastructures and the personnel. So the personnel doing these tests need to be trained. They are really, specialized personnel, their expertise. So also they need to be paid for their services. And then you need like this electricity. Electricity is key because now we know, especially in our setting and other low resource settings, we have paucity of electricity, paucity of light. So we need to have like a backup. We need like maybe solar system, or we need inverters, which actually all incur costs. So these all those costs actually make blood donation and processing expensive and sometimes prohibitive to the people actually receiving the blood, because to their thinking and to their perception, these are all free. But it's not really free. And also the transportation of the blood. So when like the blood is donated and processed, and it has to be tested also for compatibility, which incurs another cost. So when you're transporting the blood, like from where it has been donated to the various units, you need specialized containers to carry the blood, because the blood has to be kept at a certain temperature. Otherwise, it's going to be spoiled, and it will actually encourage growth of bacteria, which are dangerous when you actually transfuse these blood, and it will lead to various adverse events. It can even lead to the death of a patient. So these are all important. And also, when you're talking about transportation, actually the vehicles to transport these units, maybe you're transporting them to other clinics, to other hospitals, you need petrol in the car, which is also another cost. And you need someone to transport it, whom has to be paid. So all these, they incur significant amount of costs. Thank you.
Okay, thank you, Dr. Aisha, for that response. There's a general belief that most people are, would I say, discouraged sometimes to even go to hospitals to donate blood, because there's a general belief that, if I come to donate my blood, they will just sell it out and all of that. So I think, or actually maybe this could even be a follow-up question. In what way do you think we could even educate, the general donors or people in general that, these are actually expensive. They're actually expensive processes that within, blood donation. And it's not just that your blood is being sold to another person that needs it, because that's the general ideology. And I think that also contributes to the low, donation rates that we currently have. So do you think there's any way that maybe clinicians can sensitize people on these processes that we currently, you've currently explained?
Yeah, of course. So there are a lot of myths and, fear about blood donation and blood transfusion. So I think the best thing for us to do, which we always do, is, to have educational, educational programs, advocacy and awareness programs, so that people will actually understand the process of blood donation, and they will understand all the costs that are attached to it, because people really think it is free. And like you said, they really think like maybe blood is being sold, but blood, you can't buy blood. It's unethical. Blood is not being sold at anywhere. All those costs are attached to its process. And like I have explained earlier, you have heard what I've all said from the beginning, every step incurs costs. So I think, we always talk on the radio, TV, and during Blood Donor Day also, we actually, give educational talks, to the community, so that the community would actually understand. I think we should also engage with the local leaders and the community health workers so that actually people that are in remote areas will be able to understand, what blood donation and processing actually entails. Thank you.
Okay, thank you for that, Dr. Aisha. So the next question I have, which is kind of a follow-up as well, but that will be for Dr. Ibrahim, would be for him to explain the general economic benefits and implications of integrating technology into the blood management system.
Well, if you look at it from all the perspective, a lot of resources go into producing a bag of blood. And this bag of blood has a very short shelf life, depending on what type of anticoagulant you're using to cultivate it. So we take typical maybe just a month. And within this a month, you have to probably discard that bag. So the first economic benefit is usually you may have blood that stays in the blood bank and expires. So now there is wastage. Not because there are no people in need of that blood, because the information is not there. You don't even know that it has reached expiry date. So now if you have a technology that can prompt you about the expiry period of your product, that can be minimized a lot. And if you look at also the aspect of, let's say, issues of, let's say, getting donors. These donors, even though they are voluntary, they need to be actually reminded to come to provide their blood. So if you are donors coming, like Jamil was explaining, Biscuit, he explained that it gives you push-up notification that, okay, this is your time for donation. So to even build the reserve of voluntary donors, you need that. And that has economic advantage, because if you don't have the donors, you don't have the blood. And if you don't have the blood, you can't supply it to the people. So the other aspect is the issue of accountability. A blood bag that comes to you, if you're documenting it, you may not even find the record in the blood clinic. And that's the question you are mentioning, the allegation of people saying that their blood has been sold. There's possibility of that because they're paid donors, people that are giving money to provide blood. And if your system is not robust, the blood can come into your system, somebody can pick it up and sell it out to someone. So if you have a technology, it gives you like inflow and outflow record. You know exactly you barcoded this blood, you know what comes into the blood donor clinic. And at the level of blood bank, you know whether this barcode has been removed and this has gone out and your system. So accountability is there. So issues of theft and more transparency also. Like if you have transparency, you build confidence. People are confident now they can come to hospital and donate because they have seen the fate of their blood. They've seen your blood has been utilized and probably saved someone's life. Maybe a woman having obstetric hemorrhage, a cancer patient, or someone with sickle cell disease. So all these things, I think, overall provide a lot of economic advantages, having technology integrated, if you look at it at the gross level. Thank you.
Okay. So thank you so much for that. Do you think there will be any potential implications of like technological integration for job roles within the blood management sector? I know currently, we have people that do the processing of the blood and all of that, but if we integrate technology into this particular process, is there a possibility of maybe job loss for some of these people that are currently within the blood management sector?
Well, I do not foresee that because right now what we are battling is trying to meet the demand, and technology can only enhance access. It does not take away your role entirely. If now you're reaching 10,000 people with technology, you can reach 100,000, and probably you have 1 million people in need of that. So it's an issue of trying to even meet the technology. Let's take the high-income countries, United States, England, and every other country that qualifies for that term. They have integrated technology, but they're still even demanding manpower from low-resource countries like Nigeria to go there and work. So if you introduce technology, you increase more access and the demand also increased, and that's the reality. So no job loss, probably more jobs will open up.
Okay, thank you for that. So at least we can see from that response that technology actually will help to streamline the processes and reduce operational costs associated with the whole blood management system. So my next question is for Dr. Aisha to just give us some of the key innovative ways that can help to address the blood crisis, especially in developing and low-income countries.
Okay. So some of the key innovative ways include one, like mobile blood donor units. So when you have mobile blood donor units, it's actually easier for the donors to know where they can actually go and donate blood. You know, like areas could be allocated and the mobile blood units could be moving to different areas. And the donors could actually be informed that these are the areas where they could go and actually donate blood. Because the challenge we have mostly now is blood is kind of concentrated in just some areas, especially in the urban areas. And even in the urban areas, it's usually in the teaching hospitals, like tertiary or secondary facilities, where they have a system of blood donation and blood transfusion, because most other centers don't have. So especially when you're talking about the remote areas. So those mobile donor units can actually help, and it will encourage the donors to actually go and donate. And then secondly, like I've mentioned earlier, is collaborating with the local leaders and community health workers, so that they can actually encourage the community, so that they can remove the fears and the myth and the cultural taboos around blood transfusion, because people still have a lot of myths attached to blood donation and blood transfusion. So when we have them, especially when they talk at the local level, I think people will actually understand the importance of blood donation and, blood transfusion when needed. And thirdly, we could have like maybe a telemedicine, or shall I say, virtual communication between the urban and remote areas, especially when it comes to blood management, so that at least a person doesn't have to be there physically, but we can monitor and know what is happening at the remote areas, at the rural areas. So this will really improve a lot. I think lastly, we could have like, I don't know whether it's feasible because we're talking about low resource settings, but maybe like portable refrigerators that could have a solar energy attached to them, or inverters that could be used in actually those remote areas. Because as we all know, light is a challenge for us, electricity is a challenge for us. So all those areas, remote areas, in the rural areas, they don't have facilities for, keeping the blood even when it's donated. So this will lead to spoilage of blood and wastages of blood. And in any way, we don't even have enough blood here, because most of our blood are from family replacement instead of voluntary, non-remunerated donors. So I think this will really help a lot overall. Thank you.
So I think Dr. Aisha has touched on all the innovative ways that can help to address the blood crisis in developing countries. So just because of time, and so that we can obviously address some of the questions we have on the chat box, I'll be moving forward. So Jamil, please, would like you to talk on the pilot program that's about to happen with the BiSKIT innovation at the Aminu Kano Teaching Hospital, and some of the potential impacts of this intervention.
Okay, thank you. And to be quick, just like you mentioned, and like I mentioned earlier, the main criteria we used to identify the right partner for the pilot was first of all, that partner should share the passion and foresight that we have. And clearly from our conversations with Dr. Ibrahim and Dr. Aisha, we could easily tell as if we built the system together, we share the same ideas. And then secondly, because it's all part of the community service, we referred a partner that is in the same geographical location in any of the areas where eHealth Africa has a footprint. And luckily enough, we have AKTH right in our HQ state, which is Kano. So these were the few criteria that we had. And so AKTH in general and the hematology department in particular was a perfect fit. As for the potential impacts, we are expecting the system to, like we discussed, generally improve the blood supply management process of the hospital, because as we are trying to deploy the system, if there are any gaps or existing challenges that would be addressed, there would also be capacity building across the entire human resource in the supply chain. And this will result in a more efficient process that is accountable, transparent, and will build trust, just like we mentioned earlier on, not only on the medical staff side, but also on the donor side. Secondly, the integrated donor application that allows users to schedule blood donation and also be able to track the utilization of the donated blood will result in increase in the frequency of donors. Just like you mentioned also, Onome, that perception of what the blood is being used for will all be resolved, and will also result in an increase in the availability of the blood. Since there will be more donors, that means there would be more blood products available, especially during emergencies that we don't have a chance to start contacting family and friends. And sometimes because of the complexity in the finding the right match, the right blood type, that hopefully would reduce. And the real-time data visualization that we have on the system will also improve the overall decision-making and proper planning, especially during outbreaks. But most importantly, we are hoping to see a significant decrease in advanced complications due to delay or inavailability of the blood products. Thank you.
Okay, thank you for that, Jamil. Please, would like Dr. Ibrahim to just say a word on that, especially from the AKTH perspective, please.
Yeah, I think Jamil has explained all the potential benefits. We can't wait to have a system in the sense that you could see that we reduce wastage. And wastage is one of the problems that we face. Secondly, it will improve efficiency. We can now, the woman that is in labor, that's bleeding, the doctor can quickly glance through and see that is there a blood A group in the blood bank, is there all available, and he can make a request so that the blood bank can be ready. And it is even where we have mass trauma, where you need more blood, you can send push-up messages to potential donors to come and donate so that you can provide a lot of blood, because certainly these are things that you don't want to happen, but it's nature. Sometimes they do happen. You can have mass casualty where the blood system can be inundated and the requests need to be optimized. So a lot of benefits for us, from accountability, transparency, to improving donor confidence, to improving their self-efficacy to donate, to making the system more efficient. Thank you.
Okay, thank you, Dr. Ibrahim, for that. I think we'll be looking forward to that pilot program starting very soon. So the next question I have actually is for you, Dr. Aisha, and it's just for us to talk about, to quickly just speak about some of the challenges that hospitals and patients face when it comes to supply of potent quality blood. Please feel free to also talk about how, maybe Biscuit, you could use Biscuit as an example, or any other innovative blood management system that you can think of would obviously help to close this gap that we have currently.
Okay, thank you. So one of the major challenges is actually the donor availability, because we still have paucity of donors. we don't have many donors because of the beliefs of the, cultural taboos, like I've explained earlier. So there are a lot of myths attached to blood donation, and also because of the unavailability of the donation centers. So when we improve the donor recruitment, actually by using, for instance, the application, the Biscuit application, actually, the donors will easily access sites that they should come and donate, and they would actually be able to access their history, like how many pints they have donated and how the blood has even been used, whether it has been even used or wasted. So they will all know when they look at the application, because they will all have access to the application. So improving donor recruitment is key. And it will also produce a culture of regular blood donation, thereby sustaining the blood pool, which is very important because that's what we need. We need to have blood at all times because of all what Dr. Ibrahim has explained earlier, maybe when you have mass casualties, when you have a woman bleeding in labor and etc. So blood is essential. And then another challenge that donors face, or we face in low resource setting, is actually the cost, like I have explained. So the only way we can actually bypass or improve on this is actually to collaborate with, other funding agencies or with government, when we have like a private-public partnership, we'll be able to get more funds because all this needs money. So you need money for the equipment, you need money for the kits, you need money for reagents, you need money for the electricity and etc. So once we have funding, it will actually be easier to actually, ablate, or what shall I say, kind of face these challenges. So thirdly, also the awareness. I will stress on this every time because still people are not aware of the importance of blood transfusion and the importance of blood donation. So when we have more of those educational programs in radios, in TV, in TVs, in maybe public gatherings, we could have more talks on Blood Donation Day, and actually when we interact or collaborate with those community leaders, local leaders, and community health workers, they can actually penetrate, the remote areas, and then people will be more educated and understand the importance of blood donation. So I think virtually these are the major challenges. So most places actually, especially in the high resource settings, they actually subsidize blood donation process. But in our area, it's really difficult because it's very costly, and how things are going, the economic situation. So maybe it's just that collaboration that will actually help us to actually be able to fund all those, and then to bring in the government at all times. The government needs to actually help on this. So I think virtually these are, in summary, the challenges that donors face.
Thank you very much, Dr. Aisha. That was very extensive. So I think before we get into the Q&A, I know we have a lot of questions on the chat box. My final question actually goes to Dr. Ibrahim. I mean, we've talked about all the positives of, these innovative blood management systems, but do you think there are any challenges? If you could just round up and say this in like 30 seconds, do you think there are any challenges that could come with, these innovations that are coming up currently?
Yeah, of course, every natural phenomena or even unnatural has merit and demerit. So we anticipate there will be challenges with the data management because there will be patient-protected health information that you're going to collect, and the security of those information is quite important. So where the data is warehoused, who has the infrastructure, who pays for that. And, like introducing any technology, the cost of the technology also, the initial infrastructure is a challenge, especially if nobody is funding it, if you are the one to buy. And there will be also challenges with training people, because transition from manual to automated system always comes with, there are laggard people that really don't take up technology easily. So you have to do a lot of training to ensure that things are going correctly. And we know there are regulations, especially there are regulations, especially with that data privacy. These are things that we have to dive into to ensure that this technology doesn't in any way breach any of these regulations. So the challenges are there, the pitfalls are there, but I think they have foreseeable solutions.
Okay, thank you for your response. So I think we can just get into the questions that we currently have in the chat box. The very first question we have is, good afternoon, everyone. This is from Abdul Malik Umar. Good afternoon, everyone. Please, I want to ask if people with tattoos can donate blood. So, I don't know.
They generally, the recommendations, people tattoos don't donate, okay, because all those classifications have tendency to carry like infections like hepatitis B or other. So because of the safety issue, but in the near future, probably if the data is available about the safety, probably that can be revised, but currently they are not encouraged to donate.
Okay, thank you for that. I hope that answers your question, Abdul Malik. The next question we have is from Umar. Good afternoon, everyone. And this is directed to Dr. Aisha. So he says, Dr. Aisha stated that blood is not sold. Are there any modalities put in place to checkmate private hospitals from selling blood, or are they allowed to sell blood? I mean, maybe placing a fee on the blood aside from the processing fee.
So really, it's unethical to sell blood, but of course, like Dr. Ibrahim has explained, the system is porous, so people really do sell blood, but we don't have any kind of a system to checkmate all those private hospitals. But once we have these digital platforms and applications, it'll be easier to actually have an audit and have a stock of what we have, what is going in and what is going out, and it's easier, it's transparent, so that we'll be actually able to know. So a lot of times, we have blood missing and we don't know where it has gone because there's no system to actually checkmate it. This, I'm even talking to you in federal, teaching hospitals, not to even talk of the private hospitals, because they're even harder to actually control. And there are many private hospitals, and some of them really, like most of them, don't even have a blood blood banking system. They don't have. So they usually sell and buy blood at, randomly anyhow. So I think this application and this, this biscuit that eHealth is planning to actually launch, I think this will really, really go a long way. And we're really excited to have it because it's going to reduce all this, selling and disappearance of blood without any accountability. Okay,
thank you for that, Dr. Aisha. So I think we have another question on the chat box. I think this is directed to Jamil. So Isaac Blair says, can you explain how innovative blood donation management systems differ from traditional approaches?
Okay, that's an interesting question. I think you meant to say how the digital how digital blood donation management systems differ from the traditional, which is the in terms of the process, it's not different. What digitalization does is to automate the manual process, and by so doing, taking away all the possible errors and loopholes and overheads that are caused by the human intervention. But the process, we had a number of sessions with Dr. Ibrahim and Dr. Aisha and the rest of the hematology department to understand how the process works. That's why I talked about customizing the system to fit into the context of Nigeria, because across different countries, they have different management process. Mostly 50% or even more the same, but then some few differences. So that's what we have done over the few months, and this is now why we want to pilot, because during the pilot time, we would also be able to learn. Like Dr. Ibrahim mentioned, there will be challenges. Already we've taken care of some few ones. We made sure that we are hosting the system in AKTH so that they have control of the data. We are already talking with NIDDA to make sure that we have all the license. We have done some few trainings, but we also plan to do more trainings to build the capacity and manage the change that will come with the implementation. So to answer your question, the difference is the efficiency and nothing more.
Okay, thank you for that, Jamil. We don't have a lot of time left, so I'll just pick 2 questions for us to answer. I think this one is pretty, I think Dr. Aisha or Dr. Ibrahim could easily answer that. So someone says, is it psychologically all right for recipient to know his donor? So just in a few seconds, is it okay for?
I think it's not necessary, but if he wants to know, he can. I think that should be open to the recipients. And people have different psychology. What works for another person might not work for another person. So generally it's anonymous. But if you want to know, we don't want to name the person, but you can know that it has been used for a patient with this. But if you are so curious to know, probably there are other regulations of ethics that we can go around to identify the person that has
just to add to that, partly the question is because we mentioned that the donor is able to track the utilization of, but there is a limit. What the doctors call the de-identified information. So it's not that I don't know who exactly uses the blood, but at least like Dr. Amal mentioned, he's going to know whether the blood was utilized or unfortunately was wasted, and information like that just to build the trust and confidence of the donors.
I want to add a little bit to what Dr. Ibrahim has mentioned. So like in our system here, we don't really have a lot of voluntary, donors. So most of the donors are family replacement. So actually, like I can say, I want my sister to donate for me. So in that aspect, I know who the donor is. So that is completely allowed. But if it's just like voluntary donors that have donated, then that's when the ethics come. But really, some of our blood in the teaching hospital are even tagged, because some people just prefer to get blood from their relations, because that's how our system is now. We have not moved to that level of having blood at all times, So I think in that case, if that answers your question.
Yeah, thank you for the responses to that question. So the very final question, just because we have 2 minutes left, is how can we address issues around donor commercialization, which has been a great gap that needs to be tackled professionally? Thank you.
So I think that there is an agency, National Blood Transfusion Commission, which has been set up by law in Nigeria to regulate blood banks and blood donation practice. And they have the mandate. And we know this is a very, very big area. There is a component of blood that you are allowed to incentivize, which is a plasma. Even in the United States, or wherever people are paid to donate plasma because we can produce immunoglobulins from it, a lot of pharmaceutical aspect of it. For the blood, nobody will do that. Right from the days of the Richard Titmus that convinced the World Health Assembly to make donation to be voluntary and non-remunerated. So I think we need to work on that to strengthen the national blood transfusion services, so that when we have enough of voluntary donors, then the need of selling will even be eliminated. So we can strengthen that aspect, which will take time, but we are happy that the agency is being headed by the capable people.
Okay, thank you for that. So I think our time is already fast spent. So just to round up our session today, we would like to hear some final words. And if possible, when you're giving your final word, you could just, in a few sentences, just give us some things or some future trends that you anticipate will maybe change the blood donation management system moving forward. And that would be nice. So we could incorporate that answer into all of our final words. So Dr. Aisha, you could go first, and then Dr. Ibrahim, and then Jamil, please.
Okay, so I think this biscuit, we're really excited about it because the blood is essential and we need to have, an efficient blood management system. And by including this into our system is really going to help a lot. It's going to improve the donor recruitment, it's going to improve in the processing, and it's also going to improve in the blood transfusion services. So I think by and large, we're so excited and we cannot wait. And it's highly innovative and, it's going to solve a lot of problems. And it's also going to actually encourage the donors to donate blood because they know how their blood is being used. So I think in summary, that's what I wanted to say. Thank you very much.
Yes, thank you.
From my side, I want to say thank you to eHealth Africa for bringing this solution to the table and for piloting it with our department and our teaching hospital. We foresee this integrating all blood banks in Kano in the near future so that you can have what we want. Just the analogy I want to draw here is like, remember those days when you have to go to the bank and withdraw from the table. And now that you have an app that you can buy stuff on POS and everything. So this is what we want with the blood system. You have the management platform digitalized. So the whole process is going to be more efficient, more easy for everybody. So we look forward to it. Thank you.
Yeah, thank you. Dr. Aisha. I like the analogy of that. It's more or less like what we have now with the cloud storage system. Nobody cares where the data, where your information is stored, but it's stored somewhere in a database. People even think it's in cloud, but actually it's just a network of storage systems. So to respond to your comments, Onome, I think the future looks quite exciting and promising, especially with the major primary stakeholders involved, which are the medical doctors. We're hoping the impact data from the pilot will facilitate a multi-directional scale-up of BiSKIT to integrate other blood donation centers and health facilities, just like Dr. Ibrahim mentioned, so that blood products are easily accessible and lives are saved. The analytics data, and with the aid of AI capabilities, will facilitate accurate predictions of potential outbreaks, among other things, and will enable proactive decisions and implementation of preventive measures. Our ultimate goal is to scale up the system to be adopted by the National Blood Bank so that hospitals are able to check the national database and find matching blood product nearest to them and use the BiSKIT logistic feature to request and transport the blood products at the shortest possible time. Thank you, everybody.
Okay, so thank you to all our panelists for all their insightful contributions today. And thank you everyone for staying and being part of this webinar. Don't forget to follow us on all our social media handles for more insightful information and news. So just another reminder, we'll be having the upcoming Learning Insights Forum on the 31st of July, and we will share more information around this on our website and all social media channels that we currently have. So I'd like to appreciate everyone again for joining us and then see you on the next webinar. Thank you and bye, everyone.
Bye.
Thank you. Bye-bye.
Bye.